Welcome back, folks, and Dr. George Salib is here today, and of course he is with the Orange County Eye Institute.
Yes,
nice to see you today.
Nice seeing you too, thank you.
Great. We were talking about how hot it was over the weekend. We made it through, right?
Just barely, yeah.
All right, you wanted to talk about, I think, a subject that kind of scares people when they first hear about it, that they may have it, and that is glaucoma. And we've heard about this quite often, and even there's been some famous celebrities in the past that have talked about that they start to contact this. What is glaucoma, and when does it usually present itself?
Glaucoma is actually an eye disease that where pressure of the eye affects the nerve of the eye that allows you to see, called the optic nerve. And once that pressure starts to affect that optic nerve, then you start to have a loss of your side vision or your peripheral vision. You could see in this diagram over here on the right side of the picture is where the front of the eye is, where the cornea and the lens is. And on the back portion of the eye, there's an optic nerve that extends from the back of the eye on the left, and that goes straight to the brain. And we look at that nerve in the eye clinic, and we look at that nerve and see the contour of the nerve. If it's nice and pink and healthy looking, that's a normal nerve, and the nerve will usually have a central kind of white cup area that's called. And if that is nice and pink and the cup is small, then the nerve is thought to be healthy. In glaucoma, on the other hand, the nerve tissue starts to get thinned, and the cup in the center, that white portion of the nerve that's called the cup, starts to grow. And that cup will start to eat away at the tissue of the nerve, and that's called a glaucomatous nerve. And you can see that on the screen. On the right is the glaucoma nerve, and you can see the white portion is much bigger than the one on the left, where the nerve is normal. And all those blood vessels coming out, that's also normal. So,
okay.
And it usually presents itself at around the age of 54. That's the average age of presentation.
Okay. How would this come up during a normal eye exam, or would the person start to notice something in their vision? You mentioned peripheral vision.
Right, right. You know, unfortunately, this is not something that most people will notice. And by the time they notice something, it's much too late. I had one patient, he was 47 years old, young guy, very healthy, has a family history of having glaucoma, complained of some loss of vision. And when I saw his nerves, I was very saddened to see that he had lost a lot of his nerve and it was damaged. And his pressures were twice that of a normal person. So he had lost a significant amount of vision. So most people can't tell they have glaucoma until it's too late, which really underscores the fact that you really need to come in for eye exams on a regular basis. And when I examine you, if I see that your nerve looks suspicious for glaucoma, then we go ahead and do a battery of tests, which would include, for instance, optic nerve photography like this. We do optic nerve analyses, we measure your pressures, we measure the thickness of the front of your eye called the cornea. And then lastly, we do a visual field test, which is a test where you push a button every time you see a light. And that tests your peripheral vision. Most people think their peripheral vision is fine because they don't really test each eye individually. And they don't look at the outside and the inside portion of each eye. But that visual field test shows us like a plot of white areas and black areas, and the black areas are the parts you can't see. And as glaucoma increases or gets worse, those black areas become more and more prominent to the point where it almost becomes like a tunnel. You get this tunnel vision effect, and then all you see is the central portion of things, which isn't really a problem if there's not important things on the side. But for instance, if you have someone who, if you have, let's say, some people walking single file across the street, and all you see are the first two people, but you miss that third person, well, it could be a problem.
Right.
So people with moderate to severe visual field loss have a 4 times higher rate of getting into a car accident compared to someone who doesn't.
Now, you mentioned peripheral vision. Even if you don't have glaucoma, does your peripheral vision diminish normally as you age?
There is some age-related aspects to it. That's why when we do the visual field testing, we actually input the age of the patient
Okay.
into the machine, and it compares you to people of your own age range.
How common is glaucoma, and what causes it? Is it hereditary? You mentioned this one patient that it seemed to be in other family members, or it was, or is it something that it's just there, it just happens, just the way some other person may get nearsightedness or farsightedness or
Right.
something like that?
Well, it is one of the more common reasons, actually. It's one of the leading causes of blindness in this country. And it affects about 2 million people in this country at this time. But it's thought that over the next few years, the numbers are going to increase to about 3 million plus. The scary thing is about glaucoma is that most people don't even realize they have glaucoma. And about 10% of people who do have glaucoma end up losing all of their vision within 10 to 20 years if left untreated. And yes, as you said, there's a lot of factors that will increase your chance of having glaucoma. Family history is a huge factor. We're noticing a lot of genetic predispositions of people to having glaucoma. So we're discovering more and more genes that are related to glaucoma. Sometimes people will have other factors such as diabetes, higher low blood pressure. If you're nearsighted, your chance is higher. If you've had trauma, or even if you're taking certain medications like steroids for other medical conditions like prednisone, that can increase your chance. But the problem is it's basically an inflow and an outflow problem.
Okay.
The fluid is produced in the eye.
Is this what we're seeing on the screen
exactly. This is kind of a diagram where the front of the eye is on the top, and on the bottom, this is where the lens, and on the side is the ciliary body, and that produces the flow of fluid as it comes around the lens and goes towards the front part of the eye, and then it exits a part of the eye called the angle of the eye, and the angle of the eye allows the fluid to exit. So if the inflow is higher than the outflow, you'll have a higher pressure and more damage.
You mentioned that a lot of times people don't know if they have it. Are there some symptoms, though, that may occur that people may start to question there's something going on here?
Most of the time, no. Although you will start to see in advanced cases, you'll start to have a loss of vision. Again, you might detect some loss of peripheral vision later on. There's certain types of glaucoma called angle closure glaucoma, where you can have a sudden rise of pressure, and then you'll have pain and nausea and possibly vomiting. But that's quite more rare than the open angle type, where you have this kind of slow loss of vision.
Is that what we're seeing here, progression?
Yeah, these are the visual field tests, and you could see on the upper left is the least severe, upper right is more severe, and then on the bottom portion is where you have that tunnel vision effect with a simulation of this picture of these two kids.
Is glaucoma always bilateral, or can be just in one eye?
Most of the time it's in both eyes, although you can have it start in one eye first, and I often will monitor that other eye and not start treatment unless I really think it's necessary. But in general, it is a bilateral disease.
And treatments, what is it to the point where there's techniques that can at least slow it down? I know it can't, once it's there, it can't be stopped, but can at least be slowed down?
It certainly can be slowed down, and people can have very good vision for a long time as long as they keep very faithful to the treatment. The problem is, since people don't usually feel the effects of glaucoma, they tend to forget to use their eye drops or their treatment. So we first start with eye drops, and there's different drops that we can use to either lower the pressure by decreasing the amount of inflow or increasing the amount of outflow from the eye. I also like to start off with some laser treatments. One is called selective laser trabeculoplasty, and it's a 5 to 10 minute procedure in the office where it's a cool laser designed to treat the area of the eye where fluid exits the eye, so it increases the fluid exiting. And that's effective in about 80% of the cases. And then there's surgeries. There are surgeries where we can put shunts in the eye, we can create openings in the eye to allow fluid out. Or on the upper right, you actually see the smallest implantable device approved in the United States. It's 1 millimeter long.
Wow. And
it's used to create an opening through which fluid can exit the eye and lower the pressure.
Okay, does this go into the nerve itself?
It actually goes into the front part of the eye called the angle of the eye, and it sits in that angle to allow fluid out. It's actually made by a company here in Laguna Hills.
Really?
Yeah.
Now, if you had this in, would somebody see it, or is it so tiny that?
Oh no, it's so tiny and it's in a part that no one can see.
All right. So at this point, is there any way to go into the actual optic nerve to relieve, much the same way somebody has, I guess this would almost, has a high cholesterol where they can go into an artery or blood vessel and put a stent in there. At this point, is there something like that?
No, not for glaucoma. There are
Okay.
certain other conditions where you might have to release the tension around the nerve, but that's a completely different issue.
Okay.
For glaucoma, we generally treat from the front of the eye to
Okay.
lower the pressure.
All right, so the key is eye exams.
Definitely key, because you never know if you have glaucoma. Most people don't even know if their relatives, their parents, or their siblings have glaucoma, so it's imperative that you really get checked at least yearly, and if you have glaucoma, more often.
Okay, and I understand that you're available to speak at clubs. Am
I
I right?
certainly am. I'm always available to do that. I'm happy to do so. I love educating people about eye problems, and I'm happy to answer their questions as well.
All right, very good. And this was certainly very educational, and I can see how important the eye exams are. And so you suggest yearly to start out with, and then obviously you see there's no problems there, then they come back in another year and so on.
That's right, exactly.
All right, very good. Well, if you'd like to give Dr. Saliba a call, his number's on the screen, 949-380-EYES. I think that's pretty easy to remember, 380-EYES. Or you can go online to the oceyeinstitute.com, and he can help you out. And if you're someone who would just like him to come and speak at your club, I think that would be wonderful. We have a lot of clubs here in the village that have to deal with health and wellness living and things like that. I think that'd be a perfect opportunity for Dr. Saliba to come there and give a talk on that. Very nice.
Thank you.
Very good. Nice to see you again.
Nice seeing you
All right,
too.
stay cool.
I
All right.
will.
All right, folks, we'll be right back with Rayso.